I am proud to be a co-president of CNA and NOC, and I especially want to thank Education and Labor Committee Chair George Miller, who is a great champion of healthcare reform of RNs and of all working people. In your consideration of changes to our healthcare system, you should know that registered nurses are the profession most trusted by the American public, as shown consistently in Gallup's annual poll on this question. Nurses are on the front lines of what I can only call a patient care crisis. As a critical care nurse at the University of California, San Diego Medical Center, I see patients whose conditions are much worse because they avoided earlier treatment due to the high cost. Though they arrive sicker, they leave quicker than they should because their insurance companies won't approve medically appropriate care. I can tell you from my more than 34 years of personal experience, insurance companies ration care. The current systems ration care based on the ability to pay. Some patients, like 17-year-old Natalie Sarkeesian, do not get the life-saving treatment they need. In Natalie's case, she needed a liver transplant, but Cigna would not approve it until I and hundreds of others protested. During one of the protests, I was with Hilda, Natalie's mother, when she got the call that Cigna had approved the transplant, but it was too late. Natalie died an hour later. It doesn't have to be this way. We agree with presidential candidate Obama, who called health care a basic human right, and we agree with now President Obama, who says health care reform is not a luxury. It is a necessity that cannot wait. The same is true of health care itself. Right now, we are the only nation on earth that barters human life for money. We need a guaranteed single standard of high-quality health care for all. To make the change we need, let's have a real policy debate on the merits. People talk about evidence-based practice. We need evidence-based policy. If we were to have a debate on containing costs, improving quality, and universality, the single-payer advantage would be clear. Let's consider the principles President Obama has established. First, reduce costs. In a survey of 8 major industrialized countries, the U.S. fared the worst in out-of-pocket costs and the number of chronically ill adults foregoing care because of costs, even though the U.S. spends twice as much per capita on health care as the others. 25% of Americans are skipping doctor's visits because of cost, and that was before the recession. According to another survey in October 2008, 38% of Americans who are insured delayed care because of out-of-pocket costs. The reason? Premiums have been rising 4 times as fast as family income in the past decade, and copays, deductibles, and other transaction fees the insurance industry imposes that can run to thousands of dollars a year on top of premiums. That, along with denying claims, is how the for-profit insurance companies make money, which ultimately is their job for their shareholders, not authorizing care delivery. Unless you can stop the insurance industry price gouging, we simply cannot make health care affordable, which means you either have price controls on the insurance industry or you take them out of the equation through a single-payer reform. Cost controls are much better addressed under single-payer mechanisms like those contained in H.R. 676, global budgets to hospitals and clinics based on their patient care operations, negotiated reimbursements to providers, bulk purchasing and negotiated prices for prescription drugs, incentives for preventive care, and reliance on primary care. Second, guaranteed choice. How many Americans under 65 can go to any doctor of their choice without incurring additional costs or at all? Very, very few, certainly not those 94% of U.S. metropolitan areas that are served by 1 or 2 insurance companies, as shown in the AMA's 2008 study of insurance markets. Insurance coverage and companies now control patient choice of provider and treatment, often with terrible health results. I often relay the story of a patient seriously ill and in need of immediate intubation who turned up in an emergency room in my community. He needed to be intubated, which is the insertion of a breathing tube, to save his life. Because he was so worried about cost, the patient looked up at his nurses and doctors caring for him and said, "Can you wait till next week? I'll be 65 and have Medicare." Respectfully, that is not the way my patients or their providers should be making their healthcare decisions, nor is it the way our nation should force its citizens to evaluate their healthcare decisions. One of the great advantages of single payer is that it guarantees patients the ongoing choice of a doctor or other provider who are paid for providing treatment on the same basis. Third, ensuring affordable care for all. Here again, single payer has the advantage from a clinical point of view. Taiwan is the most recent country to have adopted single payer in 1995. The percentage of people with health insurance climbed from 57% to 97%, yet the expanded coverage produced little, if any, increase in overall healthcare spending beyond normal growth due to rising population and income. Taiwan had a system much like ours, multi-payer, dysfunctional, and broken. They made the switch just a decade ago, though some people said it could not be done with great success for their people. The U.S. ranks among 19 leading industrialized nations in preventable deaths. We rank last among 19 leading industrial nations in preventable deaths. We're last out of 19. If the U.S. matched the top 3, France, Japan, and Australia, in timely and effective care, 101,000 few Americans would die every year. In a study released earlier this year by CNA, and which is included as an exhibit in my written testimony, it has been shown that extending Medicare to all would not only provide desperately needed medical care to millions, but would also result in the creation of 2.6 million new jobs in this nation. The evidence is clear. Single payer works. It best meets the President's principles, and most important, it best meets the needs of my patients, for whom I have a professional responsibility to advocate for. Our history proves that with political leadership, any reform that benefits the American people as a whole is politically viable. Dare we waste this moment with a reform that will not adequately control costs, be truly universal, improve quality, and guarantee choice of doctors and providers? Or will we leave the American people feeling the moment has wasted and that once again they cannot trust their government to genuinely act in their interests? Let's enact single payer and let's put patients first. Thank you very much.
Thank you.